Dear all, I hope you are all dealing very well with the calamity that mankind is facing right now. This is not the first time we are facing something at that level. Hopefully, we will be able to overcome this time as well as we did in the past. I understand the mankind has a very good quality of resilience, and with the help of that, they will be able to sustain. As a matter of fact, we have always proven to beat the odds. We are the only species which is actually thriving on the planet at this time. We are facing this challenge, and I'm going to talk about a special aspect of this challenge. This challenge is causing a severe loss or feeling of loss or impending loss to us. I have lost a friend. Many of my known acquaintances and friends are either working in ICU around the world or they are themselves patients. So I have a feeling what's going on, but I still remain hopeful. I want to emphasize on one thing, that any loss or impending loss, a first reaction of people is anger or denial and then anger. And this is the time period. This is the time when we win or lose the war. Our decisions, our approach to the disaster is primarily very, very important. So now what I'm talking about is to keep our cool, keep our nerves calm, and focus on how to beat this virus. Number one thing we have to remember, that over the period of thousands of years, any calamity we face in the form of any other species threatening us, the size of that beast has been decreasing. It used to be big animals that we were afraid of in the past, but we conquered them. We found out the ways of dealing with them, but our enemy started getting smaller in size, and he's gone to the molecular level, and that's what we are talking about. My name is Dr. Faruqi. My profession is psychiatry. I'm a psychiatrist practicing in the community and the hospital for many years. I have seen patients dying from medical illness such as cancer or others. But I have never seen patient I've never seen a patient dying who has lost hope or who has not lost hope. Patient usually give up. Although they are trying to seek help, they go to the emergency room, they go to their family doctor or specialist. But what I am seeing the pattern here now also, the people go for help and go home and they are found dead in their bed or in their bedrooms. This is what is concerning me about what is happening. I'm afraid they are dying of the fear. They are dying because they are losing hope. I understand this virus is causing serious pathology in lung, such as fluid accumulation, ARDS, and so on and so forth. But again, lot of people are surviving. I want you to get lesson from those people who are surviving. They are keeping their hopes up. They remain positive. They are not making their own decisions. They are listening to their loved ones and the professionals they are in contact with and getting the treatment in time. So please have a good attitude towards this beast, which is the smallest or smaller, but is the most lethal enemy that mankind is facing. So part of it, the what I'm is especially focusing on here is to get to know. Don't undermine your enemy. Get to know what is the best. People are saying wearing mask on the both sides, victim or a prospective victim, is saving life. So wear mask. Please find out the way. Please do not go out of the house because mask is not doing anything. Please do not stop going to the emergency room because they are not going to do anything. Please listen to the experts what they are saying. For the sake of time, I'm not repeating that information, but I will give you one example. Steam inhalation with a certain oils or simply clove that is used in you've been used for many years. So please, if you suspect you have even a normal influenza, just use the clove oil or clove inhalations 3 or 4 times a day. Such things are available on internet. I'm not going into that aspect of treatment. What I'm emphasizing here is that please do not lose hope. Don't sit back. Don't be lazy. Don't take time to take action. Work on the recovery process, and recovery process starts right from home. That number one thing, do not get out of the home unless you need to. Number two, we understand there are there are various type of people who work on daily wages and things, but please try to contact the community, stay in touch with the community, help them, and don't be afraid of getting help from them. And lastly, I will say that please maintain the physical distance. I'm calling it physical distance because I don't want you to be socially distant. You are already using media, social media, WhatsApp, whatnot. And please continue to use them to stay close socially, but distant physically, kept involved with them. Call the friends and families you haven't called for a long time. Uh, Take this opportunity when you are staying home, be in touch with as many people as you can. And so I'm going to do today. I've already started that. I start with taking the calls of those unwanted calls that you have. The people, the friend, the family, you didn't want to see them. Please take their call and call them back if you miss their call. And stay in touch and stay in touch through the media or with a good physical distance to get help and help other people out. I'm quite sure by taking these simple measures, you will be able to beat the odds and beat this enemy. One thing I just want to add in the end is that I wanted to talk in the beginning is this viral infection can manifest in several ways, but I will go down deep a little bit at the molecular level. It can interact with the neurochemicals in and outside the brain and cause depression, and that may be killing more people than the really physical causes. So, and that is the most preventable level, most preventable measures that can work for it. So please seek help online, call someone for help if you feel like that, and get involved in dealing with the symptoms of depression or anxiety or fear, phobia that you are having. And one thing, again, in this relation, I want to add that viruses may release the chemicals. We all, the doctors community, the medical community knows very well that there are number of inflammatory chemicals. We call them cytokines, substance P, and so on and so forth. They may act like an antagonist of serotonin or other neurochemicals, and which can be directly involved in changing the mental state. So please watch it, watch for your for the symptom, both physical as well as mental health, and and you will be ready to fight this beast out. Thank you.